Hi, I'm Dr. Chris Ward with the Dental Implant Center of Oklahoma. One of the questions that comes up periodically when we're talking about doing surgery, whether that involves taking a few teeth out or dealing with restoring the full mouth, the question of bleeding, what type of bleeding should I expect and how do I control that bleeding? With bleeding, it's different for different people. Obviously, there's medications that some patients are on, whether it's dealing with heart issues or strokes or things where they have to thin the blood with medication. Those situations we confer with the docs and we make sure that if we need to change or alter the medications, we do that, and we do that prior to surgery. But just in general, and with a healthy patient, you can expect bleeding for a day or two. It's gonna ooze and seep or weep as a part of that healing process. So how do you manage the bleeding where it's not stopping? That's the concern that people have, and it's really fairly uncommon. But one of the ways that we talk about doing that is we want to use compression, whether it's with gauze, we send you home with sterile gauze, or you can steep black tea, just boil it for 2 or 3 minutes, and then pull it out, let it cool off. And then you can use that, and there's tannins in that tea bag which help with hemostasis or bleeding to stop. So you put pressure on that, and that can help the bleeding to stop as well. Obviously, ice helps. It helps slow the blood flow to the area, so that's another good way to stop the bleeding. The other things that we want to avoid are, we don't want straws, smoking, things that potentially can cause dry sockets. Dry socket is when the clot itself comes out of the wound and the bone's exposed to air, and that's very painful. There's not a lot you can do to help that pain until that blood kind of comes back in there and fills that wound again. So we really want to try to avoid that. So with the sucking through straws or any negative pressure like smoking, it can dry that and pull those clots, so you want to avoid that. Most of the time with surgeries, we don't have a lot of bleeding afterwards. I rarely get any concerns with that in terms of excessive bleeding. Obviously, we want to minimize the strenuous activities for a day or two, just kind of take it easy. Physically, the more your blood pressure gets up, the more your blood flows, the more that it's going to cause pressure on that new wound and those little capillaries that are just healing. So we want to try to minimize that blood flow to those areas for a couple of days to let that heal. And those are for pretty big surgeries that we do. Hopefully that's helpful. And at the Dental Implant Center of Oklahoma, we are blessed. We've got a great practice. We get to help a lot of people. And hopefully these videos kind of answer some of the questions for you, maybe reduce some of the anxiety that you have before dental treatment. Thanks.